And part 3, I can't wait. All right, for part 3, our plan will be to answer how do bronchodilators work, um, how are corticosteroids used, how are antihistamines used, and how do they differ from one another, and how are other therapies like diuretics and antibiotics and oxygen used in the treatment of respiratory disease. So, bronchodilators are used to treat bronchoconstriction. We said earlier how bronchoconstriction is an overreaction of a respiratory defense. It happens when the smooth muscles around the bronchial or the bronchi constrict, and it can be secondary to an airborne allergen such as pollen or an irritant like smoke or dust or perfume. And sometimes it's idiopathic. We cannot find a cause, but this happens. We have a normal bronchial and it gets constricted. And so we can use some sort of a medication to dilate it. And that's what we'll talk about. Bronchodilators can work in two different ways. One way is to stimulate beta 2 receptors on the bronchioles, and these will cause the smooth muscle to relax, and that will make the bronchial dilate. And you may recall what we learned last month when we learned about the sympathetic nervous system. Remember, the sympathetic nervous system is your fight or flight system, and it uses the neurotransmitter called norepinephrine and the hormone called epinephrine. They both do similar things. Um, they are agonists to different receptors, and they are an agonist to beta 1 receptors. When they stimulate beta 1 receptors, they make the heart beat faster. When they stimulate beta 2 receptors on the airways, they cause them to dilate. And they have other effects. They make your pupils dilate. Norepinephrine is why epinephrine gets released from the adrenal glands. And just as a reminder, right, beta 1 receptors are found on cardiac muscle. In particular, they're found on the specialized cardiac muscle that we find in the sinoatrial node. But for today, we care about the beta 2 receptors. And to help you remember, right, you've got one heart, so beta 1, and two lungs, beta 2. So one way that the beta, that bronchodilators work is by stimulating the beta 2 receptors. And these agonists, these beta 2 agonists can be non-selective, such as epinephrine, or they can be selective. So by non-selective, I mean it's going to stimulate every adrenergic receptor, alpha 1, alpha 2, beta 1, beta 2. Right, that's epinephrine, that's the hormone, but it can be made into a medication. Some people have heard of EpiPens. That people carry this around. People with certain allergies, people with peanut allergies. The peanut allergy could cause widespread inflammation, making the airways constrict. And if it's really severe, we call that anaphylaxis. But the EpiPen will dilate the airways, but it will also make the heart rate go crazy fast. So we usually only use, we don't usually want to stimulate the heart and the airways, but sometimes it comes in handy. This is not a good example, but if you've seen the movie Pulp Fiction, you've seen this scene where John Travolta injects epinephrine into Uma Thurman's heart. That's why they developed newer bronchodilators that are selective. So these are known as by names like terbutaline, albuterol, metoprolol. My own son used to take albuterol in something like this. These are selective to the beta 2 receptors. So they call these selective beta 2 agonists, and they have fewer, but still some beta 1 effects. So it could still make the heart beat a little faster, but it's more selective for the beta 2 receptors. These also last longer than epinephrine, and they can be incorporated into these things called metered dose inhalers. You may know them as puffers or rescue inhalers. And you've seen kids, let me see here. Sorry. Well, yeah, so you've seen kids with things like that. Let me go back here. They can make those for horses and dogs and cats too. So this horse could be receiving a dose of terbutaline or albuterol to help. This horse could have bronchitis, and that's why they're using this. Now, these are not, they can't be used every day. They cannot be used every day because they lose their effectiveness if they are used every day. If you use them every day, the beta 2 receptors will say, we're getting this medication every day. We don't need so many of us. I don't know if it's a defense or why, but with constant stimulation, some of the beta 2 receptors will go away. We get a reduced number on the bronchial smooth muscle. That's called down regulation. So instead of having 10 receptors, you'll end up with, 3 receptors. And you'd have to give more and more and more albuterol for it to work. So we save these drugs for acute asthma, or you could say acute bronchitis attacks. And that's why this term rescue inhaler is used. It's really just more for an emergency situation. Maybe emergency is not the right word. We could just say a really severe flare up. As we said, bronchodilators can work in 2 different ways. Stimulating beta 2 receptors is one way. Now let's talk about a completely different bronchodilator. These use methylxanthines. I'm sure, well, you might remember these from a few weeks ago. Methylxanthines are found in chocolate and coffee. They're a stimulant, a central nervous system stimulant, but they're also found in drugs like theophylline and aminophylline. And we're not 100% sure how they work, but here's what we think. So I'll explain why I have the Cookie Monster here. When bronchioles are stimulated to dilate, they do so by producing a compound called cyclic AMP or CAMP, and it's related to ATP. CAMP causes the relaxation of smooth muscle. Moments later, an enzyme called phosphodiesterase destroys CAMP. So in this little video, the Cookie Monster is the enzyme phosphodiesterase, and the cookies are CAMP molecules. And that's fine. That's what enzymes do. It's not a problem. But wouldn't it be nice if we could tell the enzyme Cookie Monster to back off just for a moment? That's what these drugs do. If we tell Cookie Monster to back off for a moment, then the cyclic AMP, right, this CAMP, can last a little bit longer. It can last a little longer and work its magic to dilate the bronchioles. So Cookie Monster, hold it. That's what theophylline and aminophylline do. Now that means you could use them daily, but and we use theophylline more often. It's made in a sustained release formulation. That makes it easier for owners to give. I can't recall, I think it's given twice a day, but there are some problems with theophylline. It can upset the stomach, but more important is it has a narrow therapeutic index. That means the beneficial dose and the toxic dose are not far from each other. In other words, it would be easy to overdose the patient. And that's important because we have to be careful using aminophylline or theophylline with other drugs. Theophylline, aminophylline, they depend on the liver for metabolism, like most drugs. And other drugs that also use the liver, like phenobarbital, may slow down metabolism of theophylline. If that happens, if theophylline is not being metabolized, then the levels of theophylline will start to increase. And remember, when I say metabolized, I mean destroyed. That's usually what metabolism means. It usually means the liver is destroying the drug, making it into a water soluble form that can be urinated away. That's not always what it means, but that's usually what it means. And again, that's why it matters, right? So if a patient is on theophylline and phenobarbital, we have to be careful because we don't want to overdose them. That's not a problem with albuterol, right? Albuterol, we only use it for acute situations, so we don't have that problem with albuterol. Finally, let's talk about a few other drugs that we might use. One would be antimicrobials. This could be to treat a bacterial infection or a fungal infection. I suppose it could treat a viral infection, but mostly we mean antibiotics. So antibiotics are going to treat um, bacterial infections. Um, and it'd be nice to have the selection based on the shape and gram stain of the bacteria. Now, that's not always possible. It's usually not possible because the bacteria are down in the alveoli. But sometimes we can do a culture. But most of the time we have to make the selection based on the most likely bacteria. I just wanted to include this here just to remind people that um, that we're facing super bugs. We're facing bacteria that are becoming resistant to antibiotics, and so we need to do our part to pick the right antibiotic. We also need to educate clients. Um, some clients we may say, okay, give this antibiotic for 10 days. And the patient might be better after 5 days. And so the client says, oh, I'm done. I don't need to give it for 5 more days. That is dangerous because um, the patient might be better, but there may still be bacteria that have not died yet. So we want to treat for at least 7 to 10 days. That should make certain that the bacteria are all killed. Don't Clients need to know to to follow the dosing instructions and um, not stop early. And we'll learn more about antibiotics in chapter 10. I wanted to say a few things about these metered dose inhalers, those puffers. We talked about how you can use them with beta 2 agonists. We will talk about corticosteroids. They can be used with antibiotics. There are some really cool advantages to these MDIs. And pardon me just for a second. Okay, again, just making sure that I'm still recording. So some cool advantages are we deliver the medication where it's needed, right? The problem is in the airways. We can deliver it to the airways. If we give an injection or a pill, well, it's got to get absorbed, and maybe it'll go through the liver and eventually reach the lungs. So these are nice because we can use a lower concentration and it'll be more effective. Whether it's a beta 2 agonist like albuterol or a corticosteroid or an antibiotic, it's more effective. The disadvantage is some patients just don't like them. You can't make a cat use a puffer, but there are devices like this that work pretty well. You just have to acclimate the cat or dog or horse to using them, and that's what you are seeing at the start of each section. That's a horse with a metered dose inhaler. Let's talk about corticosteroids. We learned about those a few weeks ago. You learned about how they reduce inflammation. They're very powerful, and so these are great for bronchitis. They should not be used if there's infection. So if a patient had kennel cough, we would not use corticosteroids. If a patient had pneumonia, we would not use corticosteroids. They are powerful anti-inflammatory drugs. Yay. They also stabilize these cells called mast cells. And mast cells are where histamine comes from. Histamine is a little chemical. It plays a role in the redness and swelling of inflammation. It's not a bad thing, but it can be excessive and it can contribute to bronchoconstriction problems. This is a mast cell, and these little purple things is histamine. I don't actually know what this is supposed to be back here, but you can just pretend it's another mast cell, right? So mast cells, if you have bad allergies, like my wife and son have bad allergies, they're sniffling and sneezing, and they've got red eyes. It's not coronavirus, but it's their mast cells are releasing histamine, and that's part of why they have the red irritated eyes and the swollen nose and and all that. the and we can use corticosteroids can help prevent that. And a nice thing about corticosteroids is that they can reverse it. You could give it after histamine has been released, but antihistamines do not work that way. So there are drugs like Benadryl. Benadryl is an antihistamine. It does not reduce ongoing inflammation. It works better if it's given before histamine is released. Antihistamines, they block receptors to this histamine chemical. And if you give it after histamine has been released, they just don't work that well. So we would give it before. And so for example, I think this is the same slide, kind of, right? Anyway, so for example, one antihistamine we use is Benadryl, that's called diphenhydramine. One that we used to use in horses, we might still, is called triple, how do you say that? Triple enamine. Horses can have can be allergic to dust. I think they call it, the condition, they call it stable dust. That's the lay term. One example of how we might use Benadryl is some dogs, the owner may say that he had a mild or maybe a severe vaccine reaction. So sometimes we'll have owners give an antihistamine like Benadryl prior to a visit. That way, if the dog tries to have an allergic reaction, it won't be so severe because the antihistamine will help prevent all of the histamine's effects. The last couple of things we'll look at here, diuretics we learned about in the chapter on cardiovascular drugs. Diuretics, they make you urinate. They promote the loss of body water through decreased reabsorption by the kidneys. And we use them to treat pulmonary edema. They can dry out respiratory secretions that will make the mucus more thick, and that makes it less effective. Remember that mucus is part of that mucociliary apparatus. So we want to make sure these patients have plenty of water to drink so they don't dry out. And then a very universal drug, all of these drugs are pretty universal, but is oxygen. For really severe problems like pneumonia or pulmonary edema, we can give oxygen. That increases the concentration in the alveoli. And as we saw in that first video, that increased concentration will help oxygen diffuse into the capillaries. So a main problem, though, is how to give it. These animals are being very tolerant. This is a little cannula providing oxygen to this foal's nose and this hippo's nose. This cat is in an actual oxygen tank. I did not say fool's nose, I said foal's nose. Okay, young horse's nose. Okay, some places you have to make your own oxygen tent. So here they've taken a kennel and covered it in plastic wrap, and then they are going to run an oxygen tube in there. So you can fashion your own oxygen cage or tent if you need to. And finally, to review, bronchodilators, we learned, can override excessive bronchoconstriction, an overreaction of an otherwise helpful defense. Some bronchodilators dilate the bronchi by stimulating beta-2 receptors. These drugs may accidentally stimulate beta-1 receptors too. That can cause tachycardia. These drugs cannot be used daily because they lose effectiveness over time. Other bronchodilators, they dilate the bronchi by inhibiting an enzyme and prolonging the action of CAMP. CAMP is the cookie. These can be used daily, but they have a narrow therapeutic index, so must be used with caution. Antimicrobials can be used to treat respiratory infections. Client education is important. For long-term control of inflammatory conditions like bronchitis, corticosteroids may be used with caution. Corticosteroids can help with reducing the inflammation that plays a role in bronchoconstriction. Some patients are on corticosteroids, and when necessary, they can use a rescue inhaler, for example. Antihistamines can help, but only if given before inflammation starts. Diuretics help relieve fluid buildup in the lungs. I just wanted to say my son had asthma, so he used corticosteroids every day. I think it was called Flovent or fluticasone. So every day he would take a little puff of that. But if things got really bad, then we would bring out the beta-2 agonist, albuterol, and give him that. And we actually had that in a nebulizer. And finally, oxygen therapy can be life-saving, but some animals may resent the treatment. And now that's important because if a patient is struggling to breathe, right, they're struggling because they have some severe respiratory disease, and then you shove this cone on their head, this mask, and they freak out, that could kill them. So we have to be very, very diplomatic when we use oxygen for some patients. Again, call me if you have any questions, and I will post the original PowerPoints as well. And I hope this was helpful. Any feedback you want to give me, I Would love to hear. All right, everyone. I'll send any announcements about other things going on this week, and certainly I hope you all have a very great Easter break and stay healthy. Okay, take care.